G'day, my name is Robert Heffernan. I'm a GP and medical educator at Rural Medical Education Australia. I've worked with the company for the past 10 years educating GP registrars and also educating medical students. Our strategic values and our goals are to educate a rural workforce locally, to provide a rural workforce to look after the community and make sure there's better health outcomes for communities. We've had great success doing this over the past 22 years as a company, supplying a workforce to rural areas, and proven that this model is very successful in terms of providing a high level of care for local communities by local communities. At Rural Medical Education Australia, we value excellence in educational teaching, and our staff come from a variety of backgrounds across the health system. The majority of our staff being clinicians and people who have been trained in medical education. We are especially skilled at delivering education across the rural landscape, having dealt with registrars and medical students across the vast expanse of Queensland. Our strength is in our ability to provide education in the local environment, meaningful education for patients or for students to engage with at their local clinical site. Our experience in providing this rural education over the past 10 years is quite comparable to what we'd expect in China. We have been over to China and to Shanghai a number of years ago and tried to get an understanding of the Chinese experience. And certainly there is similarities between the Australian medical experience and the Chinese medical experience. There's major health issues related to chronic disease and ageing population, and that's quite comparable to what we've taught in the past to our registrars and medical students in Australia. Our programs are based on up-to-date curriculums and modelled on the RACGP curriculum, and through this we'll be able to provide a comprehensive level of education for a medical practitioner in China to provide better care to their local population.